Continuing with the lower limb, the femur, tibia, and patella meet at the knee. The lower limb transfers the body weight to the ground, so it has to be pretty substantial. It consists of the bones of the thigh, which is the proximal portion of the limb, the femur, that's the largest bone, and then the leg, which is the distal portion of the limb. So whenever we just say leg, we mean lower leg. If we say thigh, we mean upper leg. So the leg, or the lower portion, contains the tibia and fibula, and it's connected by interosseous membrane at the tibia and fibula. So here is yet another type of fibrous joint or articulation. You have a kneecap that has the patella. At the ankle, you have the tarsals, and at the foot, you have the metatarsals and phalanges. So this is the femur, the longest and heaviest body or bone in the body. You have a femoral head at the very top, very prominent. It articulates with the pelvis at the acetabulum. You have the fovea capitis. That's a small pit in the center of the femoral head that attaches the acetabulum to the femur. You have a very prominent neck of a femur that joins the head to the shaft, about 125-degree angle. You have a greater trochanter, which is the large rough projection that extends laterally from the head and shaft. This is also the attachment site for very large tendons. You have the lesser trochanter, which is on the inside. It's a smaller projection. You also have the introchanteric crest and line. This marks the edge of the articular capsule on the anterior surface. You have the gluteal tuberosity. This is the attachment site for the gluteus maximus muscle. And the linea aspera, which is the attachment site for the powerful hip muscles. The popliteal surface at the posterior view is a flattened triangular area. We have both medial and lateral condyles at the edge of the distal end. And these are separated by what we call the patellar surface, smooth surface where the patella glides. And we have the intercondylar fossa posteriorly here. If we look at the patella, it's a large sesamoid bone. It forms in the quadriceps tendon. At the base, it's an attachment area for the quadriceps tendon, and at the apex, it's an attachment area for the patellar ligament. That connects the patella to the tibia. We also have a lateral facet for the lateral condyle of the femur, and then a medial facet for the medial condyle of the femur. Moving down the lower limb, this is large. The tibia is the large medial bone of the limb. Remember, we remember the size of bones by instruments. Tibia is more like a tuba. The fibula is more like a flute. We have an intercondylar eminence shown here. It's a ridge separating the medial and lateral tibial condyles. Here anteriorly we see a tibial tuberosity, which is an attachment site of the patellar ligament. And then we have an anterior margin, basically the shin. It's a ridge beginning at the tibial tuberosity that extends along the anterior surface. At the very bottom are prominent projections that you feel at your ankle. We have the medial malleolus on the inside It's really medial support for the ankle joint. If we look at the smaller bone, the fibula, it doesn't participate in the knee joint at all, as you can see up here. It doesn't bear weight. It's a site of attachment for muscles of the foot and toes, though. We do have a head of the fibula at the proximal end that articulates with the tibia. And at the bottom we have lateral malleolus. It provides lateral stability to the ankle. The functions of the ankle and foot bones: they accept the body weight from the leg, they transfer the weight to the ground, they distribute the weight through the foot bones, and the ankle and foot bones together have to be strong but yet flexible to carry the weight, but to also allow a lot of movement, distribution of the weight. The ankle has 7 tarsal bones, the calcaneus being the largest at the back, or the heel bone. The body weight's transmitted from the talus here to the calcaneus, to the ground. A rough knob-shaped projection on the posterior portion is for attachment of the calcaneal tendon, also called the Achilles tendon. The talus is the part that transmits the body weight from the tibia towards the toes. The trochlea is a spool or pulley-shaped articular process here between the tibia and talus. And you don't have to memorize the rest of these bones, but you do have the navicular, cuboid, and then what we refer to as the cuneiform bones that are arranged in rows. We move to the middle of the foot where we have the metatarsal bones. Again, they're numbered like your carpals, your metacarpals, 1 through 5, from medial on the inside to lateral on the outside. So metatarsal 1 we call the hallux, that's your big toe or great toe. 1 through 3 articulate with the cuneiform bones, and 4 and 5 articulate with the cuboid bone. When we look at the phalanges, the hallux, which is the great toe, only has 2 bones, of proximal and distal, and all the other toes do have 3 bones, proximal, middle, and distal.
This is the foot. The ankle and the back half of the foot is made of 7 bones called the tarsals. The biggest and most posterior tarsal is called calcaneus. Calcaneus forms the heel. Right in front of calcaneus is a bone called talus. Talus is the bone that articulates with the tibia, so the weight of the body is distributed to the foot on talus. Just past the tarsals are 5 bones called the metatarsals. The toes are formed by the phalanges. Each toe has 3 phalanges, except for the big toe, which has 2 phalanges, the proximal and distal phalanx. Compared to the rest of the toes, have a proximal, middle, and distal phalanx.
If we look at the arches of the foot, we have the longitudinal arch, and there are 2 here shown, formed from the ligaments and tendons that connect the calcaneus to the distal part of the metatarsal bones. These allow for the weight transfer. The lateral calcaneal portion is less elastic, so has a much less curvature than the medial talar portion. And result of difference is an elevated medial plantar surface. It allows room for inferior surface muscles, blood vessels, and nerves. The transverse arch is formed from a change in the degree of the longitudinal curvature from medial to lateral. Now, some common fractures in this area. The dancer's fracture is a fracture of the fifth metatarsal. It usually occurs while the body weight is supported by the longitudinal arch, like in ballet dancing.